Is there only one way to assess bones in stacks of CT images? Scrolling back and forth, always trying to stick to the point of interest? Trauma and oncology cases call for a complete evaluation of the ribs and vertebral bodies to assess possible fractures or metastases. Simply scrolling through the axial slices trying to stick to the point of interest may be very time-consuming due to the rib's oblique orientation. Syngo CT bone reading revolutionizes rib and spine assessment. The planar display of the rib cage and spine facilitates the detection of lesions right away. Fractures and metastases can now be spotted and assessed immediately, saving precious minutes in situations where time is limited. This movie will show you how to evaluate CT datasets with syngo via CT bone reading. First, make sure that the study is correctly assigned to the CT bone reading workflow. If not, just right-click and select Open with CT bone reading. The application identifies and labels the ribs and displays the entire rib cage rolled on a 2D planar reformat. In addition, the vertebral bodies are tagged and the spine is presented in a stretched view for a straightforward overview of the anatomy. The automatic pre-processing performs these steps for you and has the case ready for review when opened. The layout of the screen is automatically selected depending on the monitor configuration. In this case, the study is opened with 1. An unfolded rib segment, 2. A cross-sectional rib segment, 3. An unfolded coronal sagittal spine segment, 4. A cross-sectional spine segment, and 5. 3 MPR segments with orthogonal orientations. Labeling for the ribs and vertebra are displayed in all segments. If you want to have a first look on the unfolded rib segment, notice that the rib rotation mode is active by default. That means you can roll around the rib axis by just scrolling with the mouse wheel or dragging the mouse vertically while pressing the right mouse button. If you change to the rib scrolling mode by clicking on the corresponding icon, you can then navigate through the unfolded image in the anterior or posterior direction in the same way. Window corrections can be done by dragging the mouse vertically and horizontally while pressing the middle mouse button. The left mouse button allows you to zoom when the cursor is in the periphery of the segment or to pan when the cursor is in the center of the segment. Notice how the cursor changes its shape to show the function which is active as a standard functionality, which is the same as in every other MPR segment. By clicking or dragging with the left mouse button, you can navigate along the ribs. Notice that the cross-sectional view and the 3 MPRs navigate accordingly. The unfolded view will help you to detect any lesion easily. Then you can simply click on it to correlate with the standard MPR views. Additionally, the auto zoom function and the rib labels will help you in the interpretation and reporting. You can measure any potential lesion in any of the MPR segments. All measurements will be set as findings in the Findings Navigator for further archiving. Navigation over the spine views is very similar. Just press the right mouse button and drag the mouse over the unfolded view for parallel navigation. If you proceed in the same way in the cross-sectional segment, you will navigate orthogonally along the spine without having to tilt the plane manually as you used to. Since unfolding segmentation is done automatically, breathing or complete bone fracture of the ribs or compression of the spine could lead to suboptimal segmentation or labeling. In such cases, you can optimize the unfolded view or labeling for each segment. Correcting labels is very easy. Just right-click any rib or vertebra label you want to correct, and select the new label or delete it. Notice that you can individually apply any label without affecting the other ones, or label and propagate to correct all other labels sequentially. There are also several options for correcting the automatic segmentation. For example, select the Delete icon and left-click on the rib to be deleted. Or select the Add function and left-click on the target rib in the MPR segment in order to include any missing ribs. To correct the center line of any rib, navigate to the position that you need to optimize. Activate the Edit tool and move the control points to the center of the rib and any of the MPR segments or the cross-sectional view of the rib. The new centerline will be calculated following your manual points. Furthermore, you might extend a rib in case of incomplete segmentation, which could happen, for example, with complete rib fractures. Move the marker to indicate the area where you want to extend from, activate the Extend tool, and left-click in any of the MPR segments at the spot where you want to extend it to. Would you like to share any of these unfolded views with your referring physicians? Just select the parallel spine ranges or the parallel rib ranges from the upper left corner menu of the unfolded segments. If the rib rotation mode is active, an option for radial rib ranges is available. All reconstructions are collected in the Results section of the Series Navigator for further archiving. Results are also conveniently collected in a report. To save and archive this report and the results series, and to complete the workflow, simply click the Save and Send button.